A very warm ndewo, enleo, sanu, and hello to our friends and partners at the Vaccine Foundation. We are the Nigerian CDC, and this is We Go Win. I'm Nigel Huckle. You'll also be hearing from Emma Bendel, Claire Demio, Kathy Zhang, Miriam Hashim, and Charlie Higgs. COVID-19's toll has likely been much greater than reported here, so our job in addressing vaccine hesitancy in a population of over 200 million is going to take some work. But we thank our partners at Johnson & Johnson for providing us with the vaccine doses necessary for the task. Now, half of Nigeria's population is under 18, so under the age of eligibility for vaccination. So we're clear-eyed that our strategy will target the entire adult population, no matter where they live, what language they speak, or with whom they pray. We've consulted with experts and attitudes on the ground and scholarly literature to put together a list of barriers to overcoming vaccine hesitancy in Nigeria. But let's be clear, Nigeria is one of the most difficult health landscapes in the world. We will not eliminate COVID in a year. We will not change Boko Haram's anti-health messaging in a year. We will not be able to rebuild our civil infrastructure in a year. But with your generous funding, what we can do is address mistrust of the vaccine, misinformation, and ensure the vaccine reaches all areas of Nigeria's diverse cultural landscape. Our We Go Win campaign ties together a culturally precise communications campaign, a distribution strategy that brings the vaccine to the people, and a rumor management system to address misinformation. But what does We Go Win actually mean? Well, last year, Nigerian UNICEF ambassador and singer Cobhams Asukwo wrote the hit song We Go Win to teach fellow Nigerians about COVID awareness and healthy practices. Cobhams is an icon, and music is a huge part of our culture here in Nigeria, which is why we're taking We Go Win and running with it. Our government has set a target to vaccinate 77 million people, eliminate COVID deaths, and boost health and well-being in underserved communities. So let's do it, Nigeria. Get the vaccine. We go win.
Nigeria is complicated. Misinformation runs rampant. Mistrust in authorities is deeply ingrained, and some Nigerians consider vaccines a malicious tool of the West. Diverse religious, ethnic, and language groups also make communication a real challenge. The We Go Win campaign will tackle these issues head-on. We're using a tried and true social behaviour change communication strategy to design our campaign under the 4 Cs: context, communicator, content, and channel. The polio and Ebola campaigns show us how effective influential community figures are as communicators of public health. We know that over 90% of Nigerians do not trust the government as sources of information. So we're going to put these figures front and centre of the We Go Win campaign. We will reach all cultural groups and ages through a variety of communications channels. Radio has the widest reach. 90% of Nigerians listen to radio on a weekly basis. But our country is young. The average age is only 18. So we'll also put our key messages on Twitter, Facebook, and TikTok. We Go Win will empower. It shows the people of Nigeria that by choosing to get vaccinated, they will protect their community and get their country back to business. The 4 Cs framework allows us to quickly put together successive waves of our campaign. For example, in Wave 2, it's all about encouraging Nigerians over 50 to get the vaccine. So we will platform leaders of faith. The Sultan of Sokoto, Sa'adu Abubakar, is the spiritual leader of Muslims and was key in the 2003 polio vaccination campaign. We also know that older people use radio and TV the most, and so his message will be focused on these channels. Ultimately, We Go Win will dismantle hesitancy and create demand for the vaccine.
We know our We Go Win campaign will create demand, so we're going to meet it through a robust distribution strategy. For many Nigerians, vaccine hesitancy is linked to mistrust of the healthcare system and difficulties with access and convenience. Cold Hubs are solar-powered fridges, which were originally produced by Nigerian entrepreneur Namika Ikegwanu to combat food waste, but we believe they present an opportunity to combat vaccine hesitancy as well. Every morning, Nigerians wake up, visit their local markets and shop for food. We will install 2,000 cold hubs in our markets to bring the vaccine to the people. This will provide the 70% of Nigerians living rurally who often live over 9 miles away from their closest healthcare facility with convenient access to the vaccine. The pop-ups will also create visible community vaccination, which past polio campaigns in Nigeria have shown diffuses mistrust and normalises vaccination. With the Ebola and polio campaigns leading to strong vaccination infrastructure, cold hubs address the last link in an otherwise strong vaccine supply chain and bring the vaccine to the people. Logistics-wise, cold hubs maintain a temperature of between 2 to 8 degrees Celsius, so perfect for the Johnson & Johnson vaccine. The pop-ups will be staffed by one of our 200,000 community health influencers and promoters, who are healthcare workers specifically trained to deliver healthcare to hard-to-reach populations, and they're already equipped, so can start vaccinating right away. This win-win solution addresses vaccination access and mistrust, empowers homegrown talent, and sustainably reduces food waste so rural Nigeria can prosper.
Those in public health know that even the best laid plans can go awry. History shows us that a single rumour was enough to derail our entire polio eradication campaign. So we cannot risk misinformation derailing our COVID vaccine strategy as well. So how do we make sure that We Go Win runs as smoothly as it possibly can? We intend to use part of our budget to invest in Nigerian startup SayPeace, who have pioneered artificial intelligence algorithms to identify hate speech and fake news in Nigeria. This will allow us to adjust our Get a Vaccine, We Go Win communications campaign to combat misinformation in real time, allowing key opinion leaders to address rumours and provide Nigerians with the facts. This keeps us focused on easing vaccine mistrust across all of our multicultural communities. Now, we know that COVID-19 is not Nigeria's first experience with an infectious disease outbreak, and it won't be her last. Our investment in this startup will put us in good stead to redeploy again and again and leapfrog us to the forefront of artificial intelligence research in Africa.
We Go Win is ready to start straight away. Parallel to the first wave of our communications campaign, cold hubs will upscale distribution across the country, preparing for the brand new task of vaccinating the rest of the adult population. Rumour management will be a continual real-time process to ensure the messaging is consistent with the vaccine rollout experience on the ground. Our budget is divided into 5 categories. A significant portion is allocated to funding the cold hub infrastructure. We know that one solar-panelled cold hub costs $20,000, but we also know that this is a long-term, self-sustaining social enterprise. After our vaccination efforts have finished, cold hubs will decrease food wastage and increase local farmer income, a boom for our economy that we're trying to rebuild. We've also accounted for the additional personnel cost to administer vaccines at pop-up tents near cold hubs in the markets. And we're keenly aware of Boko Haram in the north, so a portion of our budget is allocated to provide security to community healthcare workers, modelled off the 2014 polio vaccination campaign in Borno State.
We have a couple of ways to monitor the success of our strategy. The SayPeace team will help us track trending rumours, detect relevant fake news, and measure uptake through clicks and impressions. And we will keep track of vaccine uptake using our existing government immunisation record system. We will partner with a variety of organisations, faith-based, medical, and tech, to implement our plan, but we've made a point to partner with and empower Nigerian entrepreneurs like Cold Hub and SayPeace, because we believe in investing in the Nigerian economy. We believe in investing in Nigerian innovation, and we believe in investing in the Nigerian people.
Let's think about the story of young Alhaji Dauda, walking home in his village in the north after learning that vaccines are coming to his community. How will we foster with him a sense of trust? How will we instill in him the feeling that his vaccine will make a difference? We partner with his community leaders, we honor his homegrown talent, and we charge ourselves with empowering him with the right information to make his village safe. We will vaccinate 77 million people. We will end COVID deaths in Nigeria. Igbo, Yoruba, Hausa, Christian, Muslim, we are one Nigeria. We go win.